Numerous factors have contributed to the higher incidence of skin cancer in the rural and remote communities. Firstly, they've had a higher level of sun exposure throughout their life. They grew up in a time when the importance of sun safety was not as well known as what it is now, and many have worked a lot of their life in jobs outdoors. Secondly, there is the thinking that the damage is already done and it's too late to become more careful. However, it is never too late to become more careful in the sun. There will also be a higher risk of developing more dangerous melanomas and skin cancers, since men are less likely to undertake early detection practices such as self-skin checks or seeing their doctor for a full skin check. The scale of the issue currently in regional and rural communities is that the risk of developing melanoma is significantly higher for people living there compared to people living in major cities. Rural men were most at risk of developing melanomas, and their risk of melanoma is a third higher than men in the city. People living in Australia's rural areas have a lower rate of survival once a diagnosis is made, with farmers in particular having a 60% higher death rate due to melanoma and other skin cancers compared with the general population. This is a really urgent issue for the community to be aware of now, because it's easy to do something about it. Skin cancers grow on your skin where they can easily be seen, provided you're checking your skin regularly. The best time to manage skin cancer is as early as possible. When skin cancers are confined to the skin, then excision of the lesion and cure is possible. And in the vast majority of cases, it can occur with your general practitioner. When the skin cancer spreads throughout the body, then it becomes much more difficult to treat. And curing the cancer is often not possible at that stage. So finding skin cancers when they are early and before they have spread throughout the body is very important. There are multiple high-risk groups for developing skin cancer in rural and regional areas, and these include older men, since they generally have higher levels of complacency and more relaxed attitudes to sun safety, as well as being less likely to undertake early detection practices such as self-skin checks or seeing their doctor for a full skin check. If you're a man and grew up in a period where you experienced many sunburns and didn't protect yourself well from the sun and now have lots of sun damage, then you will be in a high risk group. Other high risk groups include those who have lots of moles, those who have a personal history of skin cancer, people who are receiving medication to suppress their immune system, sun-sensitive individuals who burn easily, such as those with fair skin, freckles and red hair, and those with a family history of melanoma. Accessing GPs can be a barrier in regional and rural areas. However, there are numerous things that people can do to check their skin more effectively. Irrespective of whether you see a doctor for a full skin check or not, you should be checking your skin regularly. This is because if you're looking and you identify a skin cancer, then it will be managed earlier than had it been picked up at a later stage. The other benefit is that there are some really aggressive skin cancers, such as melanoma, that will have a much better prognosis if identified as soon as possible. With regards to self-skin checks, you might not be aware of what you're looking for, and that is perfectly okay. What you really need to look for is anything that stands out from anything else that's on your skin, and that's just something that doesn't belong there. In saying that, it's worth educating yourself about the three most common skin cancers: BCC, SCC, and melanoma. Some skin cancers may not cause any issues, or you might not notice any symptoms. And this is particularly true for melanomas, the most deadly of the three common skin cancers. There are some things to look out for. With a BCC, for example, you may notice a lesion that bleeds every time you scratch or knock it, and that it just never heals or goes away. With a SCC, you might notice that it's quite tender or sore every time you accidentally knock it. It's important to note, as I said, that melanomas, however, will often not have any symptoms at all. If you find something that doesn't look normal, then get it checked as soon as possible and don't put it off. Get your partner to help as well. and get them to check all the areas that you can't see very well and to check the areas again that you've already checked. If it's difficult to get into your rural GP and you need a full skin check by a doctor, then consider finding one in a town you frequently visit and make a habit of seeing them when you visit that town and visit them as often as they advise. If you do require a skin check regularly, then talk to your doctor about how often you need one. The good thing about skin cancers is that they grow on your skin where they can be seen. Therefore, just being more aware of what is on your skin is a very good start. Managing their skin better comes down to two main issues. Firstly, it's about preventing skin cancers. So skin cancers are largely preventable, and trying to reduce your risk of getting a skin cancer is the best option. An important point with regards to reducing your risk is to understand that it's never too late to begin being more careful in the sun. And secondly, if you do develop a skin cancer, then identifying it as soon as possible is the key. And this will be through self-skin checks or full skin checks with your doctor. So for older men who don't go to the doctor often, it's a good idea to get a health checkup every year. If you have the risk factors for developing melanoma, then ask your doctor to also check your skin. Men in rural areas have significantly higher rates of cancer diagnosed at advanced stages, which demonstrates the importance of getting regular health checks from their doctors to increase the likelihood of early detection of cancers. There are many good resources available, and I recommend going to the Melanoma Patients Australia website to learn more.